Hi, I'm Dr. Mark Langgold. I'm a board-certified plastic surgeon, and one of the most common things patients tell me is, I wish I could get a clear, honest answers about rhinoplasty without having to book a consultation first. So today I'm doing exactly that. In this video, I'm going to answer the most common questions I get about rhinoplasty: candidacy, open versus closed approach, nasal tip refinement, bridge reduction, breathing concerns, recovery, risks, results, and everything in between. And what better way to do that than to make it completely free and available here on YouTube. Whether you're just starting your research or you've been thinking about this procedure for years, my goal is to give you as much clarity as possible. We're going to talk about a few things. For example, what makes someone a strong candidate for rhinoplasty? The difference between open and closed rhinoplasty, how we balance aesthetics and breathing, what recovery actually looks like, when you'll see your final result, and much more. If you're considering rhinoplasty, this video will save you hours of searching and help you understand what's truly important, especially when it comes to safety, facial harmony, and long-term results. So let's get started. By the end of this video, you should have a much clearer idea of whether rhinoplasty is right for you and what to look for when choosing your surgeon. Will I still look like me? One of the first things I tell patients is we're not here to give you a new identity. We're here to refine your natural features, not to erase them. If something about your nose feels like it throws off your facial harmony, we'll focus on subtle changes to restore balance. You'll still look like you, just with a refined nose that looks natural and feels balanced. How painful is rhinoplasty, and what does recovery look like? Most patients are surprised by how manageable the recovery is. It's more pressure and congestion than it's painful. You'll wear a cast and internal nasal splints for about 1 week, and most return to work or light activity in 7 to 10 days. We'll guide you through every stage so you always know what's normal and what's next. How long will it take to see the final result? Well, you'll notice a big difference within the first few weeks, especially once the cast comes off. We use a closed technique for rhinoplasty that's gentler and preserves your normal anatomy, so healing is a bit faster with less swelling. Most of our patients say they see ongoing improvements for 12 and even up to 24 months. We'll guide you through every phase so you always know what's normal and what's next, and when to expect those exciting milestones. As with any other procedure, it's very important to follow up with us during your scheduled postoperative appointments. Will it look fake or surgical? If you want your results like Michael Jackson, then we're not for you. But if you want results like Jennifer Aniston, Angelina Jolie, or Megan Fox, then you're talking to the right surgeon. This is probably the most common fear my patients have. For many years, people have associated nose jobs with Michael Jackson for his surgical appearing nose. Our approach is very different. We use primarily a closed technique to preserve normal anatomy and always work in harmony with your natural structure. The goal is never a one-size-fits-all result. A subtle, balanced result that looks like you and the nose you're born with. Can I afford this? It's totally normal to have those concerns about the cost. This is a big investment. We offer flexible financing options to help make it more accessible, and we'll walk you through those at your consult. In addition, some of the rhinoplasty can be done through insurance or partially through insurance if you have a history of trauma or breathing issues. We never cut corners because the outcome and your safety matters too much. What we can promise is complete transparency, no pressure, and a plan that's completely built around your goals. How do I know if I really need a rhinoplasty? Well, some people come in knowing exactly what they want to change about their nose. It could be anything from a subtle change to a more dramatic transformation. And others would like to breathe better. Whatever your goal is, we're here to address it and try to meet your expectations. What if I've had a bad nose job before? Well, revision rhinoplasty is actually a big part of what I do. Whether it's cosmetic or functional, we approach revisions with a deep respect for the challenges involved. We'll assess what's possible and build a plan that protects both form and function. Do you do male rhinoplasty? Absolutely. Men often want a strong, natural, straight profile with excellent airway. Our approach for male rhinoplasty is customized to preserve masculine features if so desired. The key is being subtle. We want to refine your nose but not necessarily change its essence. If a patient is choosing between you and a cheaper surgeon or a different surgeon, what would you want them to understand before making that decision? Well, you have to be very careful about making your decisions based on price. Rhinoplasty and nasal surgery surgery is very difficult and challenging and will change your nose for life. So it's very critical to look at surgeons' credentials, to look at surgeons' experience and their work prior to making that decision. The cost of cheaper surgery may be a lot greater in the long run than a more expensive surgery done correctly. What misconceptions do patients commonly walk into with? Well, most common misconception I would say is the patients think that their nose will look overdone, surgical, over-resected. It doesn't have to be that way. The goal is always to preserve natural anatomy, refine the nose, and only address the issues that the patient wants me to address. What do your happiest patients say changed after surgery? Well, my happiest patients generally say that the changes that were made to their nose generally enhanced their appearance and brought out their best features forward, not completely changed their identity or their face. What if I need a revision after rhinoplasty that you perform? Well, healing after rhinoplasty can be very prolonged. It can take up to 24 months for full healing to occur. What I found that majority of patients' concerns disappear or improve within that time frame. However, a small percentage of patients may not heal perfectly or still have some lingering concerns. In that case, we will certainly perform a revision if there's a visible deformity or there's a realistic concern about your nose. Those revisions are usually taken at the earliest 1 year after your surgery and will be performed by me either free of professional charge or at a very reduced cost. I'm very transparent with my patients and I am your best advocate and want you to have the best possible outcome in your rhinoplasty. By reduced cost, what I mean is my professional fee may be waived or significantly reduced. However, a lot of times I have no control over the facility fee or the anesthesia fee. We would love to see you here for a consult to go over your surgical goals. Looking forward to seeing you here at Rhinoplasty Plastic Surgery.